Hi everyone, I want to welcome you back to Voice of a Doctor. It's another Saturday and it is so good to have you with me today. I am Dr. Atse. Today we'll be talking about diabetes. I'd like you to listen, and if you like it, of course, press the like button. And for those of us joining us for the first time, the Voice of a Doctor is a channel where we talk about women and children's health mainly. So if you like it, what you've heard today, please go through our past videos and don't forget to subscribe, share with your loved ones. So please don't go away. I will be back. So I guess the first question today is, what is diabetes? Diabetes is a condition whereby the sugar in our bloodstream becomes too much. Okay, so we have what we call the sticky blood. Okay, there are different types of diabetes, and today I would be limiting my talk on type 2 diabetes. Type 2 diabetes is it's a lifelong problem. Can be controlled with medication, but we would have to live with it all lifelong, unfortunately. It does happen when the hormone in our body called insulin can no longer break down the sugars that we have in our body. Okay, and this could be as a result of a few factors. One, it could be because there is a family history, right? So if it runs in the family, then there comes a time, if care is not taken, then such a person would inherit it. It could also happen when there is inactivity. So you're living a sedentary lifestyle, you're not doing much, or overweight. And this mainly, we're looking at weight around the abdomen region, okay? Overweight generally, but more when it's, you have the abdominal weight gain. People with diabetes do present with increased thirst. So they are very, very thirsty people. They drink and they want to drink again. Likewise, there is increased urinary frequency. Sometimes they present with symptoms of feeling tired all the time. You're just tired, even when you know you haven't done enough for the day to make you tired. Also, I said to you, the blood is so sugary, sticky blood. These people present with frequent history of infection. It could be eye infection, it could be chest infection, they could have recurrent yeast infection, okay? And this could be on the skin, in the groin area, so you're having candidiasis, or you're having quite irritation under the armpit, under the breast, under folds, skin folds. Some people have weight gain, and some you see they just keep losing weight. Okay, so the presentation is quite big. Some could be that of a non-healing ulcer. So you have an ulcer, you expect that it should go, and it's still lingering there and getting worse. So these are the few presentations that comes to mind right now that people with diabetes would present with. First of all, before I go on to the treatment, I want to quickly go through complications. If it's not properly treated, what happens? Diabetes is a condition, of course, because it's presenting with so much sugar in our blood. So the blood flowing through our veins and arteries is highly filled with sugar, right? It's sticky. So if I start with the complications with where the blood is, so the blood is in the heart, the blood is in our veins and in the arteries. So over time, the sugar becomes an irritant on these things. So they could present with vascular problems. They could also present with eye problems. Okay, so they have cataract, they have problems with vision. Okay, so eye problems is one. They have problems with their skin. I talked about having fungal infection of the skin, poor wound healing, and there are further things that present to us if it's so badly controlled over a long time. Stomach, likewise, you have diarrhea, you have quite unsettled state because there's so much sugar in there. Also talking about the skin, or I'll say feet, over time they lose sensation to places like the feet, you know. So you're walking and you feel like you're walking on cotton wool, because the sensation on the feet it's gone or completely gone. So these are the few complications that could come if diabetes is not properly treated. Diabetes can be managed with medication, as well as conservative measures such as a healthy lifestyle. So you're having lifestyle modifications that involves things like good exercise, keeping yourself active, as well as eating healthy. So if we can apply all of these things, right, this does help to control the sugars, therefore making life, making one to live life as normal even when the diagnosis is there. Talking about diet, it's a very big one. One does need to understand what sort of diet people with diabetes, or everyone really in general, should adhere to in order to live a life that is diabetes free. So when we're talking about food, we want to encourage people to have a good fruit and veg, okay, daily fruits and veg. There's no overemphasis here that these things will increase fiber and the necessary minerals in our body to carry us for our daily, to carry the daily requirements that each organ needs to live, to be healthy. So I'm just going to take them all in sections. So let's look at milk, for example. If you were to take milk, we would encourage you to take something that a milk that is low in fat, low in sugars, and perhaps skimmed milk or semi-skimmed milk. We wouldn't encourage you to go for whole milk, right? Again, this is because we want to bring down fat and we want to bring down sugars that you are taking in. Another thing that we want to encourage when you're taking starchy foods, we encourage that you go on a variety of whole meal. We want things like whole wheat, right? A whole wheat bread, pasta, brown, like the brown bread, brown rice. If you're having potatoes, for example, we would encourage that you have your potatoes with the skin. So like jacket potatoes, eat it with the skin and not just eat the inside, leaving the skin. That gives you a good feel of everything and fibers. Also, we want to encourage you to have things like quinoa, rye. These ones are also rich in with low glycemic index. If you other foods like the legumes are things like beans, pulses, fish, egg, meat, all of those things. And looking at fat and oils, we want to encourage unsaturated fats, right? Plant fat that would, those are lower and better to break down. There's some, when we're talking about food in general, the truth is all food contains will contain sugars, and so when we eat, it would definitely release sugars in our bloodstream. That's where the energy comes from. But when we stick to the low glycemic index meal, then the body is able to have a good level of sugars, right? It's sustained and it's slowly broken down. That way you do not crave for snacks or to eat in between meals, because it keeps you stable and sustained until your next meal. And if you are able to achieve such a diet, if you're able to get such a diet, it then prevents the body to work so hard when you dump onto it a high glycemic index meal. When you do that, when you dump a high glycemic index meal, there is a kind of sugar rush, right? That makes that puts a challenge on the body to break and control the sugars. So this is when we're talking about foods, this is the whole logic behind the choices of foods that I mentioned earlier on. Another school of thought says that when you mix this low glycemic index foods and a high glycemic index food, you still achieve, what I'm trying to say, to keep the body on a good, on a good level where there is a slow release of the sugars rather than a sugar rush. So for example, if you were to have jam, right, I know it's difficult to take off the things that you like, but if you were to have jam, for example, and you use jam on white bread, right, that is a huge sugar rush and a huge demand on the body. However, if you were to have jam and you use the jam on a brown bread, you have given yourself a good balance, and there is still good control that, so there's a slow release of the sugars through that time period before your next meal, cutting down the need for snacking or eating in between meals. So these are the few things I thought I should share, through light when we're talking about a healthy diabetic diet.